Everyone wants peace of mind when it comes to their family's health. And if you're looking at medical cost sharing as an alternative to traditional health insurance, it's only natural to have questions that you want answered before you feel fully comfortable. I covered a few frequently asked questions in part 1 of this series and wanted to bring you a few more. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. While these questions and answers generally apply to most cost-sharing communities, it's important to read the fine print and membership guidelines of any particular one you are considering. With that, let's dive into our first question. How does pregnancy and having a baby work with medical cost sharing? The first thing to know here is that if you join a medical cost sharing community and are already pregnant, that will be considered a pre-existing condition and sharing will be limited if it's available at all. Different cost sharing communities also require that people are an active member of the community for a minimum amount of time before maternity care is shared. In addition to that, I have also seen certain faith-based cost sharing communities restrict maternity sharing in the case where the mother is unwed. This isn't the case with non-faith-based cost-sharing communities that I've seen. That said, if you've met those initial requirements for sharing, then maternity care can typically be shared according to the member guidelines. Some communities treat maternity needs like any other medical need with the same initial unshareable amount, or IUA. I've seen others who say that for maternity needs, there's a different maternity IUA of double the normal one. I'll talk more about the IUA in a moment. Continuing on with the sharing of maternity needs, if there are complications for the mother, those are included as part of the same initial need. However, if there are complications for the baby, those would be considered a separate need with its own IUA. Babies born as part of an eligible maternity need can typically be added to the sharing membership during the first 30 days after birth. Why is medical cost sharing so cheap? Should I be concerned about that? Medical cost sharing is often quite a bit more affordable than traditional health insurance, and there are a number of reasons for this. One of the largest and most obvious is that when medical cost sharing members seek out care, they are cash pay patients who have the support of their medical cost sharing community. I experienced this firsthand when having an ACL repair surgery a few years ago. Check out my episode 9 video about how all of my bills throughout the entire length of my care were heavily discounted, some up to 80%. Simply because I was a cash pay patient. I've had very similar experiences every time I've personally sought out care as a medical cost sharing member. So if you imagine this happening across a large community of people day in and day out, it's easy to see why the monthly amounts that members contribute are so low. Another reason why medical cost sharing is less expensive than traditional health insurance is the lack of shareholders. It isn't a profit-driven industry employing and paying for an army of bureaucrats who are constantly working to find ways to not have to pay your medical bills. The vast majority of your monthly payments go towards paying medical bills and not stock dividends or large corner offices for company executives. How does the initial unshareable amount work? The initial unshareable amount, or IUA, is the amount of money that an individual member must meet before any of their bills are shared with the community. With the non-faith-based medical cost-sharing communities, the IUA typically applies on what is called a per-need basis. A need would be a medical accident or illness where all of the bills exceed the IUA. Some examples of this could be a broken leg that requires surgery, a hospital stay for a bad illness, or even a cancer diagnosis. When the IUA is on a per-need basis, this is a bit different from what some people are used to with traditional insurance, where the deductible resets at each renewal period. With medical cost sharing, where the IUA is tied to that particular need, members typically only pay their IUA once for that need, no matter how long it takes to be resolved and them to return back to good health. Can I get kicked out for having a lot of very high medical bills? The short answer is no. Even if you get diagnosed with an expensive medical condition, you can't be kicked out or removed from the community. How do I know that my bills will be paid? If you're worried about whether your medical cost sharing community will run out of money, take a look at next week's episode on that specific question to learn how that's no more of a concern than it is for a large insurance company. But in addition to that, it's important to understand that as a medical cost sharing member, there's no transfer of risk associated with joining a community. At the end of the day, members are still responsible for their own medical bills. However, medical cost sharing is built upon a 40-year strong history of communities of people coming together to share in each other's burdens. If medical cost sharing communities weren't doing the right thing and sharing like they say they will, people would be jumping ship left and right, and that's just not the case. Cost sharing communities are often set up in a smart manner where they have no incentive to deny or not get members' bills shared. At the end of the day, the money put in by community members belongs only to the community, not the company helping to manage. And many put in place smart measures, such as a reserve fund, to make sure that if there was a wave of very large medical bills coming into the community, they'd be able to handle that. The last point here is to make sure that you're familiar with the membership guidelines that outline what is eligible for sharing. That's the easiest way to avoid surprises as a medical cost sharing member. If you want to explore further whether medical cost sharing could be a good fit for your family, be sure to click on the link in the description below and get in touch. And please leave any questions and thoughts you have in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with your family and friends.